Yes, good morning everyone. Study of social change.
Morning, sir.
Yes. Study of social change. Previous classes we had been learned that the technology is a key to determine the change. Then the technology impact on various technological changes impact on various social institutions. Here we have to learn first today religious life. First, negative effects. Opposed to inventions. Many religions oppose the inventions due to some customs as well as their traditional belief. Next effect, opposition to invention and innovations. Some ideas may violate some religious norms. Then social invention bring social change. For example, some social derivations, mainly legislations, has been influenced to affect. This may be negative impact on some religions. As we know that one of the example of this family planning, using family planning devices, but some religions not allowed, not like to use to, due to the religious norms. Then positive effect is more accessible. The religious moral teaching, everyone can reach. Then communication improvement between the religious and priest, etc. Then privacy and honesty. Every religion can develop their thought and religious beliefs and according to their wish and will. Then spiritualities, using new technology. For example, mobile phone. Now, every religious books are available. Holy Bible, Holy Quran, Bhagavad Gita, everything available in mobile phone. Because every religious people can easy to access and use the technology. Then moral implications. Moral teaching by multimedia. Social media using nowadays teach about their religious belief and moral values. So these are the positive effects. As the internet, mobile phone, as well as nowadays social media have been using by modern religion, which imposed to every religion become positive. An influence of culture on social change. Definite relation between belief and social change. Culture give direction and momentum to change. New arts blossom, runs of the world. Old means old culture. New arts means, for example, modern inventions which cause to change. Next section, social change, its impact on health. First, positive change promote health. Negative change affect health and cause the diseases. First, physical health, mental health, as well as social well-being, determined by changes. Then communicable diseases, non-communicable diseases, caused by social change, mainly environmental changes, by means of people interaction, lack of social distancing, cause the communicable disease. Then environmental health, the changes in environment, population change, already we had the land, biological change, categorically affect the environmental health. Look at this, environmental risk factors, air pollution, indoor sanitation, chemicals, radiation, noise, occupational risk, agricultural practices, climate change. So these are the environmental risk factors which is directly affect the health status of people. Then 10 leading causes of death due to environment. Changes, negative changes in the environment. First, stroke. Second, ischemic heart diseases. 3, unintended intentional injuries, cancer, chronic respiratory disease, diarrheal disease, neurological disorders, respiratory infections, then intentional injuries, then malaria. So 10 causes of due to environmental change and negative change in the environment. Who most impact? So mainly man and woman, mainly child is most impact, as well as elders due to the environmental change. Next, methods to improving the environment. Here indicated various methods. Look at this. Carbon strategies, public transportation, then clean fuels, occupational exposures, access to safe water, consumption patterns should be changed, sun protective behavior should be adopted, smoking should be banned, then health in all policies. So allowed to new policies need to adopt to health for all. So first, desirable for stability. Everyone would like to stable life. Any change, just opposite. Second, inadequacy of invention. Some invention may be harmful. Ignorance. Some change may be ignored. Old culture or well-being. Fourth, habit, which is very important. Tradition. Tradition means customs. Some change may be this affect the habit of living. Then cost of economic cost. Some change is not affordable. For example, costly materials. For example, medical technology concern, MRI, magnetic resonance imaging. This costly one, not a common person or poor people difficult to use that technology. That's why change. Then interest. The people may have lack of interest towards the new changes or modern materials. so that people oppose the social change, new changes. The role of nurse as change agent. Support to make positive changes. Nurse always make positive changes in the society. The following basis. First, family welfare program. Family welfare program, nurses implement that program to change the families. Family planning program to control the population. School health program promote healthier environment in learning. Then occupational health nursing promote happier and healthier work life in industrial areas. Then practice nurse change individual life. Then primary healthcare nurses change the communities. Then WHO self-explanatory role. According to this role, these nurses can be change the globe and build the peace and development. Then practice nursing, diverse role. Not only this caregiving, as well as education, health education, and diverse, multiple role. An explanation about each role and family planning program. So this program nurses, through this program, nurses make positive changes in families, including administrative, supervisory, then case finding, counseling, research, then evaluation of the nursing, family planning, and the family welfare services. Then nurse in family planning, mother care service, immunization, then prophylactic services, curative service, then MTP, monitoring, training, and planning. Then emergency obstetric care. We know that in this just a decade back, thousands of women die at the time of delivery due to lack of knowledge and mainly home deliveries. Nowadays, nurses have been wonderful role and identify the new mothers, antenatal cases, and advise to hospital deliveries and attend the emergency obstetric care to prevent maternal mortality. The nutritional counseling. So these are the role help to change in this population and control the population and promote safe motherhood and safe childhood. Next, school health program. Nurses make positive changes in the schools through following services: health supervision, appraisal, prevent diseases, then other nursing services including food, hygiene, education, counseling, mainly education regarding diet, habit. Habit is very important to mainly child in school level. The role of nurse in occupational health nursing program. Nurses change in work life in industrial area, mainly professional role, environmental role, managerial role. Then vital roles of nurse in occupational health nursing, mainly advisor, counselor, educator, environmentalist, hygienist, interpreter, leader, rehabilitator. researcher, safety expert, student, and supervisor. So these are the key role of nurse in occupational health nursing. Student, this is one of the demanded nursing service in nowadays. So this nursing service need for every industrial areas, mainly software industry, hardware industries, every modern companies. First appointed the nurses, occupational health nurses and occupational health medical professionals to promote well-being of employees in particular industrial area. So this is most demanded nursing service in modern days. This nurse only can change these positive changes in industrial areas and promote health of employees. Then 5 major practice roles. Clinician practice, administrator, educator, researcher, consultant. The role of nurse in primary health. Students, this in the practice role, nurses have been changed in individual life. For example, if a patient comes into the hospital with diseases and bad habit, the nurse have been changed the life of an individual person, change bad habit and get well and promote well-being. Then health educator, role of nurse in primary health care, change in every communities, in urban, rural, by means of education, food and proper nutrition, sanitation, immunization, then locally endemic diseases, for example, COVID-19 or any other diseases, find anywhere and identify it and prevent and control it. And treatment for minor ailment, then essential drugs. So one of the evidence is that polio eradication. The nurses doing wonderful role to do the eradicate the polio from Indian society, from India. Next, role of nurse. According to WHO, direct care provider, teacher, supervisor and manager, researcher and validator. So these are the major core role which is explained by the nurse according to WHO research. And diverse role of nurse, nursing practice. First diverse role, assessment, wound care, health promotion and education, immunization recall, TDM, chronic disease management, administrative role, sterilization, then accreditation role. What is mean by accreditation? Mainly official recognition, for example, INC, Indian Nursing Council, as well as State Nursing Council, who is officials. Now, nurses only official, So nurses are also doing administrative role, controlling the every nursing colleges, control the every nursing practices by the official responsibility of nurses. Then practice role of nurse as change agent. First practice role, effective use of Medicare, mainly medicine. Then communication improvement, strengthening partnership between primary health and other community institutions, other sectors. Then clinical database. Nowadays, data collection from data regarding the diseases, new cases, for example, incidence, prevalence, epidemiological data. So through all the services, nurses making positive changes in families, changes in population, changes in education, then industrial area, then individual life. Mainly clinical nurses make changes in individual life. Then well does work. Nurse is a fundamental role do in the world to build peace and development in our society. The role of nurses change agent. This is not for you. This content only for post-BSc nursing, 11th section. Next, social change, deviance, stress, and health. Deviance means behavior violates cultural norms. So cultural conform the cultural norms. Stress means physical factor, mental state, disturb normal functioning, contribute development of some illness and diseases, as we know that. Then theories of deviance, biological theory. According to this theory, these biological factors determine deviant behavior. Then psychological theory emphasizes psychological factors, mainly personality of individual. Personality of individual determine this deviant behavior. Then sociological theories concerning social factors. Not only a single factor is here, multiple factors, including socialization, culture, class, etc. Then functional theories emphasized by Emil Durkheim, the functional factors, mainly role, then deviance on the group, and mainly group independent, their functions. Then diverse role of the person, mainly deviance promotes social change. Then Robert Morton's strain theory, student, this is only important, this interesting theory. According to Morton, strain by means of, look at this, people feel strain when they are exposed to controlled cultural goals that they are unable to obtain. Now, everyone having different goal. We have unable to attain that goal, we feel stress. Then symbolic interaction theory. According to this theory was made by various thinkers, mainly Sutherland differential association, neutralization theory, labeling theory, primary and secondary deviation, control theory, etc. Then conflict theory. Karl Marx, Michael Foucault, then biological theory of deviance. So these are the theories regarding conflict. Then deviance, stress, strain, and health, which we will learn next class. Now, discussion time. Aswati,
Yes, sir.
Aswati, can you list nurse how to change the society?
The nurse is having a lot of role in the changing of the society. Mainly, the nurse can act as a changing agent. As a changing agent, the nurse can educate the individuals in the society and also can
So
play a major role in the
my
change of
question is
behavior in the.
Aswati, what are the program nurses having? Can you list what are the program to change the society? For example, family planning program. Are you here, Aswati?
Yes, sir.
Yes. You know, nurse means nurse. This is a general explanation. I would like this, but you need to study systematically. Nurses having different role in different program. For example, family planning program, role of nurse, and nursing services. Family welfare program and role of nurse and nursing services. Mainly clinical nursing, clinical nursing, role of nurse and their services. So, which is the systematically learning. The nurses have been systematically and organizationally change the societies in positively, which means every sections have been changes by the nurse. Any negative change happen, nurse there and try to make become positive change in the population, in the family level, in school level, in workplaces. Okay, in workplaces as well as in this individual level mainly. The nurses have been changed individual life. When a patient come into hospital with disease and disability, nurses have been changed individual personality and their bad habits and become healthier person. So excellent, Swati, wonderful answer. Thank you for your thinking and pleasant answer. So any clarification? Okay, thank you everyone. We will meet next week. Thank you. Have a nice day. Enjoy the day.
Thank you, sir.
Yes.
Thank you, sir.
Thank you,
Thank you,
sir.
sir.
Yes,
Thank you,
Santa
sir.
Maria. Krishna, yes.
Okay, sir.
Okay, okay.
Thank you, sir.
Okay, thank you all.